Hello, and welcome to Module 4 of the Peer-to-Peer program. Last week, we talked about some important questions that should be asked at a doctor's appointment, insurance coverage, treatment options, and a couple of management tools. In today's discussion, we will be guided towards developing a positive and beneficial nutritional and physical habits that will lead to optimal health and wellness. Wellness has a range of meanings depending on whose opinion you ask, and the way to which one reaches their state of optimal wellness varies even more greatly. Nutrition and physical activity begin at home and are habits that are learned early on. However, there is never a better time like the present moment to reflect upon personal wellness and make changes that can lead to better health. Years of research show that healthy eating and continual physical activity lower the risk of cardiovascular disease, diabetes, hypertension, and many types of cancer. Prevention of these chronic illnesses is most easily obtained through simple lifestyle changes and habits. Nonetheless, as a basic foundation of good health, nutrition and physical exercise at the lowest levels are topics that concern both those living with or without epilepsy. Again, the way one develops a healthy nutritional intake and increase their physical activity will depend on the individual, but the basic principles presented in this section on nutritional activity and wellness can act as a guide. In the next couple of slides, we will talk about some tools that can be utilized to understand and determine personal wellness. Body mass index, commonly called BMI, is a number calculated from a person's weight and height. It helps provide a health range of weights for varying heights. And ideally, a person should have a BMI under 25 and greater than 18.5. Lowering BMI even a small margin has shown to decrease health risks. In the BMI chart, the height is measured in feet and inches along the side, and across the top is weight in pounds. You can find your height and weight and see where they intersect. The 24-hour food recall is a common tool used in primary care to help determine basic nutritional intake. With this tool, healthcare providers ask patients to remember the food and drink consumed within the last 24 hours. This includes vegetables, fruit, carbohydrates, dairy, protein, vitamins, and other items. From the results, healthcare professions suggest changes for the patient to make their nutritional intake well-rounded. People can perform this at home. MyPlate.gov is a helpful website that was created by the government to help total and calculate the amount of vegetables, fruits, carbohydrates, dairy, protein, vitamins, and calories to simplify the process for people at home. Some simple guidelines for nutrition is to be conscious of what you are eating at all times. You should read the whole nutrition label, including the ingredients. A good rule of thumb is that if you do not recognize many of the ingredients or you cannot pronounce them, then avoid the product. You want to eat foods that are not overly processed. Be watchful of food labels. Labels that say non-fat or low-fat does not mean the product is healthy. These products are often very high in sugar. Avoid foods that contain high fructose corn syrup. This is an ingredient that is frequently used in processed products. Avoid foods that also contain trans fatty acids, which are also known as partially hydrogenated vegetable oils. Trans fats do not naturally occur in nature and are synthesized. Human bodies are not able to metabolize these type of fats. Therefore, our bodies store them in our arteries and veins. Both trans fat and high fructose corn syrup have been linked to some of the top chronic diseases. There is no one diet that works for everyone. Diets are often being advertised. However, most of these only help people lose weight temporarily. Maintaining a consistent intake is the key to overall wellness, which requires commitment to a healthy intake of nutrients on a daily basis. Working with your healthcare professionals, such as your primary care doctor, can help you to develop a healthy way to get to and to maintain a healthy weight. There are no bad unprocessed foods. Eating in moderation is important. Increase the portion size of vegetables and fruits you eat at meals and decrease everything else. Vegetables and fruits should be the greatest portion of your total intake. Limiting sweets, soft drinks, and fried foods can help to improve overall wellness and help to maintain and even lose weight. Also, try to decrease the amount of time spent eating on the go and in front of screens, such as televisions, laptops, and desktops. Eat healthy types of proteins. Decrease in the amount of processed meats like deli meats, sausage, hot dogs, and bacon can help in creating a nutritionally balanced diet. Proteins such as fish, chicken, turkey, and beans should be eaten more often than red meats, such as beef, lamb, and pork. When eating red meat, choose lean meat. Again, reading labels can be helpful when determining whether or not a cut of meat is lean. Cook your meat and protein using cooking techniques such as broiling, baking, and poaching instead of frying, charbroiling, and sautéing. If you decide to fry your food, use olive oil instead of conventional cooking oil. On a side note, when dining out, if you have a tendency to overeat, try to order entrees that are baked, boiled, and poached. When you receive your meal, ask for a to-go box and immediately box up half of the portion so that you are not tempted to eat the whole dish. Most restaurants' dishes contain more than one serving. Also, ask for substitutions to decrease the amount of oils and other sources of unhealthy fats. Another suggestion is to switch to whole grains. Choose all whole and sprouted grains for your carbohydrates. This will help to eliminate a lot of overly processed food from your diet. Choose grains such as barley, oats, quinoa, and bulgur instead of white rice, cereals, bread, and pasta made from refined grains like bleached flour. When reading labels, look for carbohydrates that contain large amounts of fiber. Work with your healthcare professional to determine how much fiber you should be getting daily. One of the most important nutritional changes you can make is to increase your vegetables and fruits each day. Everyone should eat about 2.5 cups of vegetables and fruits per day. This can easily be accomplished by having a fruit and vegetable at each meal and making snacks just fruits and vegetables. If drinking fruit or vegetable juice, make sure to check the labels to ensure that it's 100% vegetable or fruit juice. Drink these sparingly because even though they are natural, they do cause a rise in blood sugar, which can potentially trigger seizures. Try to cook all vegetables without frying or adding extra creams, sauces, and dressings. Using simple herbs and spices can help to maintain the overall nutrition of the vegetables. If you are thirsty, water is the best option for a drink. Try to avoid sugary soft drinks and beverages. If you're going to drink a soda or tea, preferably unsweetened, drink sparingly. Also, drink a glass of water before and after each meal and in between each meal. Drinking water before, during, after exercise is also important. The ketogenic diet is a diet that includes lots of fat and hardly any carbohydrates. Usually used with young children, this is a not do-it-yourself diet. It's a serious medical treatment and you must be quite disciplined to make it work. Along with a healthy diet, physical activity is essential for lifelong health and wellness and should be included in your daily routine. Physical exercise has been linked to decreasing many health risks. One should first try to adapt a physically active lifestyle before beginning a rigorous exercise routine. Exercise routines should also be approved by health professionals before starting. Having a healthy physical lifestyle can include always using the stairs, walking rather than using automobiles for short, manageable distances, and visiting people rather than calling, emailing, or texting if in a close range. Decreasing time spent sitting while watching television, using a computer, or using your phone can also help to encourage increased physical activity. Adults should get about 150 minutes of moderate exercise per week and about 75 minutes of vigorous exercise per week. That breaks down into about 30 minutes of moderate exercise 5 days a week and about 25 minutes of vigorous exercise 3 days per week. This activity does not need to be continuous. With busy schedules, sometimes it's easier for people to break down these periods of time into smaller sections. However, the most benefit will come from continuous exercise, so try to get in at least 20-minute sessions. Also, pick a type of moderate activity. This means you can still hold conversation while exercising, and vigorous activity, increasingly more difficult to hold conversation while exercising. Pick something that you enjoy. Vary activities to decrease boredom and increase interest. Some tips to help you start to be physically active is to use the stairs instead of the elevator. walk instead of driving, or park your car far away in the parking lot. Spend less time watching TV or using a computer or your phone. Also, you can exercise with a friend or join a recreational sports team. Also, if it's a nice day, try spending it outside. We've come to the end of this module. I hope you've learned something new today that could help you make healthy choices about nutrition and physical activity. Thank you again for volunteering your time towards becoming a peer educator. See you next time.